Good day everyone! My name is Princess Nikki M. Valdez. I'm a first-year student nurse and for today I will be performing positioning of patients. The first procedure in doing positioning of patient is assessment. We need to assess the client's body alignment and comfort level while client is lying down. Next, we need to assess the risk factor that may contribute to complications of immobility. Next is to assess the client's physical ability to help moving and positioning. Next is to assess the physician's order, clarify whether any positions are contraindicated because of client's condition. Next is to assess for tube incisions and equipment. Next is to assess ability and motivation of client, family members, and primary caregiver to participate in moving and positioning client in bed in anticipation of discharge to home. The next procedure is planning. We need to determine the client's need for supportive devices such as pillows, rolled or folded towels, and etc. Next is we need to determine the amount of assistance required to position the client. The next procedure is implementation. First, we need to explain the procedure to the client, what you are going to do, why is it necessary, and how the client can cooperate. Next is we need to wash our hands to observe other appropriate infection control measures. Next is to provide for client privacy. And next is to support or raise the level of bed to comfortable working height and get extra help if needed. So good morning, Mr. Dutuyato. My name is Nikki. I'm a first-year student nurse. Ang gagawin po natin ngayon ay positioning. Pero bago po tayo mag-proceed sa positioning, assess ko po muna yung mobility niyo, sir. Okay po. So, pwede po bang paganito yung hands? Kanan na po. Okay, yung kabila naman po. Okay po. So, sir, wait up, sir. Babalik po ako. Mag-wash lang po ako ng hands and then kunin po yung mga supplies.
Okay po.
Okay po. So, sir, nakapawash na po ako ng hands before ako magpunta sa room nyo. Kaya nga po lang sabi ko kanina, ang gagawin po natin ay positioning. So, bakit po ba importante ang positioning? Para po maging relax ang inyong katawan at maging komportable po kayo. Wait lang, sir. Close ko lang po yung doors and then yung curtains. Now, we will start in supine position.
Place bed flat and lower it at working height. Assist the client to the supine position. Provide supportive devices to align the client appropriately. Place a pillow of suitable thickness under the client's head. It should extend about 2 inches below client's shoulders with the head in the middle of the pillow. Place pillow under the lower legs from below the knees to the ankles. Next is place trochanter rolls about 12 to 14 inches in length along the affected hip or both hips if the client has little control over the legs. The roll should be just long enough to reach from the hip to above the knee. Place a footboard or have the patient wear the high-top sneakers to support the feet. Next is to extend the client's arms and place small pillows to reach from the elbow to wrist. If the client has actual finger and wrist flexion deformities, use hand rolls. Lower the bed and restore the unit and wash your hands.
Next is Fowler's position.
Begin by positioning the client flat on bed. Have the client flex the knees slightly before raising the head of the bed. Be certain that the client's hips are positioned directly over the point where the bed will bend when the head is raised. Raise the head of the bed to 45 degrees or the angle required. Provide supportive devices to align client appropriately. Place a small pillow or roll under the lumbar region of the back if you feel a space in the lumbar curvature. Place a small pillow under a client's head to extend 45 inches below patient's shoulder.
Are you comfortable, sir?
Yes.
Put a trochanter roll to each femur. Flex elbow and place pillow under each arm to prevent pull on the shoulder. Place 1 or 2 pillows under the lower legs from below the knee to the ankles. Support the knee with the footboard or have the client wear the high-top sneakers. Place client in good body alignment, head, neck, and back straight. The weight of the body is supported where the hips are in the sitting position. Feet are straight and toes are pointing up. Lower the bed and restore the unit. Wash your hands.
Now we will go to prone position.
Start with the bed flat and the client lying on the abdomen with the head turned to side and spine straight and legs extended. Provide supportive devices to align the client appropriately. Place a small pillow under the head so that it extends to the client's shoulders and 5 to 6 inches beyond the face. Be sure that the ear is flat against the pillow. Place a small pillow or roll under the abdomen in the space between the diaphragm and the iliac rest. The shoulders and elbows may be flexed or extended, whichever is more comfortable for the client. Place a pillow under the lower legs from below the knees to just above the ankles, or position the client on the bed so that the feet are extended in a normal anatomic position over the lower edge of the mattress. Lower the bed and restore the unit and wash your hands.
Next is lateral position.
Adjust the bed flat and the client flat on bed. Adjust the pillow toward the side in which you are intended to put the patient. Turn the patient on either side in with spine straight. Provide supportive devices to align the client appropriately. Place the pillow under the patient's head so that it extends 5 to 6 inches beyond the client's face down to the shoulders. Place the patient's arm that is against the mattress so shoulder and elbow are flexed and palm of hands is facing up. Place client's another arm so that it is extended or slightly flexed and rest it on client's hips or bring it forward and place it on a pillow. Extend the leg that is pressed against the mattress and flex the other leg and place the pillow under it so that it extends from above the knee to below the ankle. A pillow may be placed behind the client to help maintain the position. Lower the bed and restore the unit. Wash your hands.
We will now go to the last position, which is seats position.
Place a pillow under the client's head as per lateral position. Start with the bed flat and the client move and turn into the left side. Extend the client's left arm and position it behind the client's back. Flex the right arm and bring it forward. Support arm with pillow as necessary. Lower the bed and restore the unit and wash your hands.
We will now go to evaluation. We need to observe the newly positioned client. Is the client in a proper alignment? Are the positioning devices correctly placed? Is the client comfortable? And lastly is the documentation. We need to document the time and change of position, move from and to, any signs of pressure areas or contractures, any difficulty client has with breathing and use of supportive devices. That's all, sir. Thank you.
Sige po.